good.
Unbeknownst to the couples, Jimmy's mother was a carrier for ectodermal dysplasia, and Timmy's father was a carrier for Treacher syndrome. Using a Punnett square, we can calculate the probability of each couple's offspring inheriting these two conditions by predicting the genotype and phenotypes produced by possible combinations of gametes from each couple.
Treacher syndrome is an autosomal dominant disorder. Here we show Timmy's father along the top of the square as a heterozygous genotype expressing TCS, with his unaffected mother along the side. As shown, the combination of gametes from these two individuals results in either a heterozygous genotype with the dominant allele expressing TCS or an unaffected homozygous recessive genotype without the dominant allele. This produces a 1-to-1 phenotypic ratio and means that the probability of Timmy expressing the phenotype for TCS is 1 out of 2 or 50%. Ectodermal dysplasia is an X-linked recessive disorder. Here we show Jimmy's mother along the top of the square as a heterozygous carrier for ED, and his father, an unaffected male, along the side. 4 possible combinations of gametes result from these two individuals: a heterozygous female carrier, an unaffected homozygous female, an affected male with the X-linked recessive allele responsible for ED, and lastly, an unaffected male. This means that the probability of Jimmy being a male expressing the phenotype for ED is 1 out of 2 or 50%, and the chance of any female offspring of this couple expressing ED is 0.
Wait up!
Oh, hey, Timmy.
Oh, hey, Timmy. So why are you here?
Oh, I'm here to see Dr. T.
I'm here to see Dr. Sylvia.
Come on in. Hi, Timmy. Nice to meet you. Have a seat.
Give it to me straight, Doc.
Well, Timmy, you have a condition called Treacher syndrome, which is a syndrome that affects 1 in 50,000 people. It is an autosomal dominant syndrome, meaning that one of your parents passed on to you a faulty gene, and during embryogenesis, you had a mutation in the TCOF1 gene on chromosome 5. This gene encodes a protein called Treacher, which is important in mRNA formation in neural crest cells. In a small set of patients, mutations in genes POLR1D and POLR1C can also lead to Treacher syndrome. And in an even smaller subset, no mutations in the genes may also present in this syndrome.
How does that affect me?
Well, because there was a problem with the expression of this protein, there was cell death, also known as apoptosis, causing neural crest cell depletion in the first and second branchial arches. These branchial arches are responsible for cartilage, bone and connective tissue formation in the head and neck region. These anomalies in development can lead to downslanting eyes, hypoplastic mandible and zygomatic bone, underdeveloped and malformed ears, cleft palate, and eating and breathing difficulties.
Is there anything you can do to help me?
This syndrome is treated in a multidisciplinary way, meaning that a variety of head and neck specialists will be required to treat specific malformations of the region. For example, an oral and maxillofacial surgeon can treat a cleft palate, or an ophthalmologist can assess the malformations in the orbital region. Craniofacial surgery may be needed for some patients to treat bone malformations, but because this is a genetic disorder, we only have methods to manage and improve your quality of life.
Come in. Jimmy, good to see you. Have a seat.
What's wrong with me, Doc?
Jimmy, you have a unique condition.
Unique how?
You have something called ectodermal dysplasia. Let me explain further. You have the most common form of ectodermal dysplasia, or ED, called hypohydrotic dysplasia, HED, which is often characterized by abnormalities with teeth, hair, nails, and problems sweating. When you were just a developing fetus, a specific gene inherited from your mother caused developmental problems with these structures. This gene, EDA1, which is located on chromosome 2, is responsible for an X-linked recessive form of ectodermal dysplasia. The EDA gene is responsible for creating proteins that are necessary for ectoderm-mesoderm interactions during embryonic development. From these interactions, structures that originate from the ectoderm develop, such as hair, nails, teeth, and sweat glands. Because of this X-linked recessive mutation on the EDA1 gene, the development of hair, nails, teeth, and sweat glands can be negatively impacted.
Oh, so that's how my disease works.
Yes. In fact, there are more than 150 types of ectodermal dysplasia. There are 4 genes responsible for ED. EDA1 is responsible for the X-linked versions, and it accounts for about 58% of cases. EDAR and EDAR-ADD are responsible for autosomal dominant and recessive versions and accounts for about 16% and 10% respectively. WNT10A, which has only recently been identified as an affected gene, is responsible for some autosomal recessive forms and is accountable for roughly 16% of all cases of ED. Treating ED is difficult due to its genetic nature. While there is no cure, individual symptoms can be treated, focusing on improving the patient's quality of life. For example, over-the-counter topical creams can be used to reduce skin discomfort.
Oh, I think I get it.
Oh, hey, Timmy. Hey, how was your doctor's appointment? It was really informational. Good. Even though we're different together.